And we talked about health, people sort of potentially confusing what a healthy mouth looks like, straight white teeth, versus what actually a healthy mouth is, which is the absence of plaque, healthy gums that don't bleed, that your teeth are clean. That is health. And we talk about strong teeth and gums.
Yeah.
If you have not got your oral health in place, like with your skincare, if you haven't got your skincare in place,
Absolutely.
if you haven't, or not having maybe your regular facials, so if you're not brushing your teeth, if you're not having your regular hygiene visits, your mouth will have inherently more bacteria and more plaque. And then we're adding in caps on top of the teeth. Sometimes there's a little bit of a ledge between where a cap meets a tooth that can gather plaque. So you might see more gum inflammation. Suddenly your teeth become harder to clean. So really, health, that preventative aspect, your oral health, your hygiene cleans, you need to have that nailed as well before you start adding in things like crowns that make it much more difficult to look after your teeth, make you much more prone to gum disease. So there's a lot to think about here. And sometimes I think about, with skin, I know we've talked about this before, you might start with skincare, then you might progress to something like kind of facial treatments, peels, then you might progress to something like injectables. And then, do you know what? You get to a point where it might be something like a surgery, all right? Plastic surgery or blepharoplasty or something, depending on what's going on for you, and that's kind of a stage. And I know myself, I went through that journey where I thought, right, I want injectables. And then actually I was started to have conversations, and that was about 2.5 years ago. And I haven't had them yet because I upregulated my skincare, my facial care, going in for facials. And I felt like, do you know what? That's great. That's great for me. I'm 39, 40 next year. I'm feeling good about myself and I look good. And so it just kind of eked that out and made me feel much better. So that's the kind of thing I'm thinking about oral health. Like, to me, that last step in the line is where you are going for something that's irreversible.
I'm Kelly Sainer. Are you ready for some barefaced chat?